suspicion of GIST.
Okay. Where is that?
In the stomach,
Okay.
along the lesser curvature.
Thank you. Okay, for the audience, we are suspecting that this patient has a submucosal lesion in the stomach. So any comments, how should we evaluate and what should we be looking for?
Dr. Amjad, first of all, we have an endoscopic look of the lesion and then
Very good.
Place endoscopic ultrasound probe on it, and they'll examine the different layers anatomically and look for the involvement or its penetration and rule out other differential diagnosis.
Okay.
Yeah.
Which scope should you use? Would you use a linear scope or would you use the other scope?
Generally, we use a linear scope.
Okay, for the lesion in the stomach, would you prefer a radial scope or a linear scope?
We don't have any experience with the radial scope. Generally, we do all our examination with the linear scope.
Okay, that's what practically is. But so evaluating submucosal lesions, usually linear scope. If you want to biopsy that, if you want to do an FNSC, probably you would put in a linear scope, but it's always good to put in a radial scope because it has a better resolution, gives you an overall view, and you can actually use certain technique which is called as one as withdrawal technique, or you'll have to fill in the water. So the reason is that you sometimes, if you are evaluating this lesion, it's sometimes this one may be a larger one, but if you have a smaller one, it's difficult to approximate it and keep the lesion in the focal length, because if you're too near to it, you will not be able to evaluate it very well also. So you have to be away from it to look at the different layers and its involvement. So submucosal lesions are usually evaluated, number one, as you said, you have to start from the history. So age of the patient will tell you what type of a lesion you expect. Endoscopic appearance might also tell you what type of a lesion we expect, and certain mucosal characteristics, and then of course the characteristic of the lesion. The most important thing to evaluate in a submucosal lesion is the transition point where the normal stomach wall and the lesion meet. So as you already said, so one has to evaluate from which layer is it arising, and then what are the lesion characteristics: size, internal echoes, heterogeneity of the ecotexture, and the surrounding tissue. So for example, is there a lymphadenopathy or not, and all those things. So what do you think, what is the first thing you should be looking for in a submucosal lesion before we go on to this characteristic, that is it rising from the wall or not? So you have to decide if this is actually an external impression of a viscera, like a spleen or any other, there's a lymphadenopathy or anything else.
अम्मा जी लंबा सांस लीजिए।